magkaroon tayo ng access at equity. So lahat ng Pilipino magagamot ng hindi sila mababankrupt. Kasi ang number one cause ng bankruptcy in Filipino families is a member of the family getting sick or hospitalized, either to a heart attack or a stroke or some serious illness like dialysis. With the budget, 448, na-fulfill yung predictions ng health economists. The health economists way back since 2019 when the UHC law was passed, had predicted that we needed about 450 billion annually to maintain universal health coverage. So yung zero balance billing, yung may access sa mga primary care centers. So we've actually achieved that in 2026 budget. Ang maganda pa dito, this is a 73% increase of the whole DOH-wide budget. About 40% increase from the NEP. So tumaas pa sa hiningi ng DBM na budget for health. And then 19% increase on a year-on-year. So ang laki nun, 20% increase. So this is the highest jump. If you look at the graph, unti-unting tumataas yung budget ng health from, nung USEC ako, nasa 100 billion lang yan. Ngayon, nasa 448, almost half a trillion. Ang mga importanteng provisions na nakita ko na maganda na dinagdag ay yung 1 billion fund additional to each specialty hospital. So yung heart center, lung center, children's at saka kidney, dinagdagan ng 1 billion for each for their operating expense. Malaking tulong ito sa mga nagpapagamot dito na gustong magka-zero balance billing, especially yung mga complex medical procedures doon. Pangalawa, nagkaroon din tayo ng additional fund called 1 billion for the expansion of the zero balance billing sa local government unit-run hospitals. Dati po kasi, last year, 2025, in-implement natin starting July, yung zero balance billing in the 83 Department of Health hospitals in all 17 regions of the country. Very, very welcomed yun. Madaming nagpasalamat na pag sila ay nasa basic accommodation, wala na silang babayaran kahit magkano. And we have paid as much as 2.7 million in terms of funds for patients na discharge. Almost 1 million na ang serbisyohan ng zero balance billing program ni President Marcos. Also, nag-usap kami with the President just before the end of 2025 at tinanong niya sa akin kung anong dapat focus ng Health Department. I focused on 3. Number 1 is nutrition. A good nutrition will lead to a healthier population. This is for investment in the Filipino people. So yung nakatalaga para sa Department of Health ay yung tinatawag na first 1,000 days mula sa pagbubuntis hanggang sa age 2 years. Ang pangalawa, yung DSWD during the preschool at yung DepEd, meron namang feeding program during the school. So nutrition is number 1. Pangalawa, yung immunization. In fact, meron kaming program on January 19 wherein we will start the measles, rubella supplemental immunization activity. Pero gusto ko natin mabakunahan lahat ng bata with all the vaccines na kailangan nila. At pangatlo, yung primary care. Yun yung sinasabing access to healthcare. Yun yung bukas centers natin wherein communities can now go to a doctor and have laboratory testing na wala ring bayad at magkakaroon ng chronic disease. Papaliwanag din siguro ni President Edwin Mercado ng PhilHealth yung gamot program na mabibigay na yung chronic medicine. So we will prevent people from getting to the hospital. We will prevent them from getting zero balance through better primary care. So yun yung tatlo, nutrition, immunization, and better primary care for all. So pinakahuli, I think ang most important, yung provision section 19. Section 19 of the General Appropriations Act says na bawal na ang politiko. General Provision 19, Section 19 provides explicitly safeguards by prohibiting political involvement in the distribution of cash and financial assistance. And this ensures that programs such as the MAIPIP or the Medical Assistance for Indigent and Financially Incapacitated Patients and the Zero Balance Billing are implemented strictly by the authorized government personnel free from political influence, branding, and intervention. Yun akong pinaka-happy. And ang sabi nga sa akin, yun daw yung anti-EPAL provision of the General Appropriations Act. With that, maraming salamat. I'll pass the microphone to our PhilHealth President and CEO, Dr. Edwin Mercado.
Salamat, Sec Ted. Magandang umaga po. Yusek Claire, ang ating Malacañang press corps. Magandang umaga po sa ating lahat. So, ako po'y humaharap muli sa inyo pagkatapos po ng 11 buwan. At gaya po nung naulat ko nung Pebrero, nung ako po'y unang tinalaga, ay sinasabi ko pong bilang isang manggagamot, tinitingnan ko po ang PhilHealth bilang isang may sakit. At nung nakaraan pong 11 buwan ay medyo po diniagnose na natin at inalam kung ano po yung mga potential na lunas. Ngayon po ay babahagi ko po kung ano po yung mga natuklasan nga natin. Una po, tinukoy natin na ang tunay na pangangailangan ng taong bayan. Inaral po namin yung mga claims po ng ating mga miyembro at tinutukan po natin yung tinatawag na catastrophic conditions na nakakaubos po ng kita ng ating mga pamilya. Ang katunayan po, ang pruweba, ay meron po tayong 76% increase dun sa ating benefit payment. Mula ng 164.32 billion noong 2024 buong taon ay tumaas po ito ng 76% to 289.26 billion as of December 2025. Ang tanong po ay sapat po ba ito? Malinaw po, hindi pa po. Malayo pa po tayo. Kailangan natin ng malaking coverage, hindi lang po sa laga, pati po dun sa access points. Kaya hinihikayat ko nga po yung ating mga providers, both sa DOH, mga local government units at private hospitals, na mag-align po dun sa aming mga programa. At dahil po nagbabayad na kami na mabilis ngayon, I think maganda rin po yung response ng private sector na nag-affiliate na po at na-accredit dun sa aming mga Z-benefit package programs. Sa usaping halaga, inihahanda na natin ang landas tungo sa DRG-based global payment. Ito po yung bayarin o pagbabayad, method of payment, na kinukonsider po yung mga comorbidities o yung complication ng isang sakit. Ngayon po kasi pagka nagbigay ng diagnosis, pare-pareho po yung binabayad namin base po dun sa diagnosis lang. Hindi ho base kung ito ba ay may corresponding na diabetes, hypertension, other complications, kung ito ba ay matanda, bata, kung ito ba ay nangyayari sa isang lugar na talagang hikahos o gida areas. So yung pong DRG natin, magkakaroon na po yun ng computation to, parang bigyan po ng mga additional compensation po yung mga variables na isahad ko kanina. At gaya po ng paulit-ulit yung sinasabi, marami pa rin hindi nakakaalam ng mga benepisyo ng PhilHealth. Isa na po ito sa pagbabagong ginagawa natin. Dati po kasi launch and leave ang sistema Pagkatapos po ng trabaho ng paglathala ng circular, halintulad ng Z-benefits, na noong pong unang nilatag ang Z-benefits, almost 2 years po bago po nagkaroon ng initial payment or initial claims. Ngayon po talaga, naglagay po kami ng boots on ground na talaga pong maghahalagulad ng mga hospital at saka mga clinics, lalo na po itong yakap. At ito po ay in-approve ng board na may mga dagdag po tayong mga tao dito. Ngayon nga po ay end-to-end rollout na tayo. Halimbawa po ang yakap na gamot, nung una po naming nilatag ay dito lang po muna sa Metro Manila kasi marami po kaming tweaking na ginawa dun sa ating apps at sistema. Pero naipaigsi po namin ang payment terms into 15 days. Kaya marami na pong pharmacies ngayon ang nag-i-engage at lalong-lalo na start of year, maganda po ang response lalo po ng mga chains po natin. So hopefully po maipahatid po namin yan sa inyo sa maiksing panahon. Ito po ang pagkakaiba. Hindi nagtatapos sa launch. We are proactively engaging providers and members. At umaasa po kami na ngayon ka pong early first quarter of this year, habang dumadami ang providers na sumasali, lalong mararamdaman ang benepisyo ng yakap at gamot. Kasi yung nga po yung direktiba ng ating mahal na presidente na ipaubot sa ating mga pasyente down to the ground level yung aruga ng ating pamahalaan. Pangalawa, pinabilis at pinasimple na natin ang sistema ng pagbabayad. Ngayon nga po, mula nung 40 to 60 days ay naibaba na po natin ng 22 days. Binigyan natin ng flexibility ang mga valid claims, ibig po yung mga na-deny before sa reasons lang po na hindi nila na-submit on time. Binigyan po namin hanggang Marso, na extend pa nga po ng another 3 months na i-refile nila. At ito rin po kasama dun sa binigay pong direktiba ng ating mahal na presidente na for the DOH hospitals na medyo nga po meron ding mga claims na hindi umabot ay i-extend po namin yung kanilang filing para makatulong po doon sa ating zero balance bill. Pangatlo po, pinagtibay natin din yung internal capacity ng PhilHealth. Ginagawa po natin yan sa pamamagitan ng pakikipag-ugnayan sa ating mga eksperto at representante ng ating mga miyembro. So nakikipag-usap po kami doon sa mga different patient groups. Kasama na po dito yung coordination namin with the Department of Information and Communication Technology. Kami po, personally, si Sec. Henry Aguda po ang nakikipag-usap sa amin para po i-fast track yung digitalization po ng ating PhilHealth. At sa kasalukuyan nga po, meron na po kaming team na naka-embed sa DICT para ayusin po yung aming mga digital system. Ang aprobadong budget po ng PhilHealth ngayong taon ay tinitingnan po natin na isang lehitimong pagkakakilala sa mga reformang ating inumpisahan. Hudyat po ito ng panunumbalik ng tiwala, unti-unting panunumbalik ng tiwala ng taong bayan sa PhilHealth. Kumpiyansa tayo na sapat ang pondo ngayon. Habang nagmamature ang system at dumadami ang datos, makakakuha tayo ng mas malino na projections and we will adjust accordingly with full transparency. Ang hiling ko lang po ay sana naman ma-highlight din po natin yung mga positive impact ng PhilHealth kasi marami rin po nagpapatunay sa ating mga Facebook pages at saka kanilang personal posting na talaga pong naramdaman nila yung tulong po ng PhilHealth noong nakaraang taon. Kaya po sa mga provider naman, ang hinahikayat ko, handa na po ang sistema, sapat na po ang pondo, mas malaki na po ang coverage, mas mabilis ang bayad, pero kailangan po natin ng pakikiisa. Kasama na po dyan yung mga doktor natin at ating mga hospital. Magtulungan po tayo. Yun lang po. Thank you very much.
Para po sa unang katanungan, Kat Domingo, ABS-CBN.
Good morning, Secretary. Sir, Hi, sir. For Secretary Herbosa, sir, how does the Department of Health respond to the COA's findings that 405 million pesos worth of medical equipment were remained idle or unutilized due to the absence of a well-structured plan, lack of site readiness, delayed procurement actions, and inadequate coordination and monitoring? That's according to the COA, sir.
This is a COA report of December 31, 2024. So released in 2025. So you have to understand there was a whole year of 2025 to fulfill the implementation of all those programs. So I still have to check if it's still 405 million that has not been installed. I will bet na install na ang karamihan noon. So take into consideration that when you're reporting that, take the date and time that the COA did the observation.
Sir, but the spirit of the question or the point of the COA is that there was allegedly, supposedly, an absence of a well-structured plan, a lack of site readiness. How does the DOH respond to those comments given that it has received one of the biggest allocations under the 2026
I don't understand when you say there is lack of a structured plan. In government, before you can even request for the budget, you have to have a detailed province-wide investment plan for health. Merong process yan. So I don't know what the auditor means when he say walang lack of plan. Number two, before it even gets to NEP, binubusisi po yan ng regional director, ng central office ng DOH, ng DBM regional office, ng BM, before it even gets into the budget. So nakaplano po lahat yan. And then eventually, pag na-implement yan, depends who implemented it. Kasi there are many people, hindi lang DOH nag-i-implement po ng ating Health Facilities Enhancement Program. There are 3 agencies that actually implement it. The LGU itself can be the one implementing it. The DPWH can be the one implementing it. The regional office can be the one implementing it. So depending on who is implementing it, there can be some delay. And then there are different contractors. Iba-iba yan. Merong mabagal, merong nag-walk away, merong delay in one part, delay in the construction. Of course, kung na-delay yung construction, hindi mo ma-install yung equipment kasi hindi pa tapos yung facility. So you need to finish the facility or, terminate the contract and get another contractor to finish it. So talagang may problems. Those are actual problems in government governance. Talagang hindi yan masi-zero. That will always happen. And that's why you have officials to run and manage this. So you have to check. So when you report that, my suggestion to you is to look first what has happened to it in the year 2025 because that was a 2024 COA audit observation.
And sir, based on the findings of the DOH, what happened to it? What do you attribute the biggest bottleneck? What is the main culprit for the misdelivered or the misuse or the according to the COA the
So I will tell you, I
idle
will give you back, I will get back to you, and I will look at that 405 million that they're claiming, and I will tell you how much of that has already been installed or completed in 2025. Yun ang dapat hinanap nyo.
Sir, yun nga po hinahanap namin sa inyo ngayon, sir. Wala po kayong data with regard to the update on
Well,
this
I'm
one?
here to discuss the budget. If you want, I can go back to you. I will give you a report on the 405.
Sir, last na. But initially, sir, bakit po hindi na-roll out as it is on 2024 itself? Bakit po kailangan pa natin maghintay ng 2025 for it to be rolled out? What do you think is the biggest problem in the system that needs to be addressed immediately?
You're wrong, no? When a budget is released, it has a 2-year cycle. There is what's called continuing appropriations. When it is released, there are many reasons. Sometimes the money is not released to us. Sometimes the money is not available. So the money is released in the latter part of 2024. So sometimes the implementation happens in 2025. So dapat you should understand that that's how it's happened. So it's not a negative thing. It's a good thing. That's why COA monitors whether we complete the money or not. For your information, I returned only about 800 pesos of the 2025 budget. That means we already obligated a lot of the money. In 2024, we returned, I think, 800 million. So malaki yun. So there's a lot of improvement from 2024 to 2025.
Susunod na katanungan, Clay Perdilla, PTV4.
Good morning po, Secretary Herbosa. Sir, nabanggit nyo kanina mag-expand na po sa mga LGUs yung zero balance billing. How many LGUs will benefit from the additional 1 billion allotted for them? At saan po yung mga lugar na priority area? Salamat po.
So that's a good question. We only have 1 billion to support the local government, but local government hospitals are a lot. In fact, mas marami siya kaysa sa DOH hospitals. For the level 1 hospitals, ang feeling namin, kaya na siya i-support nung increased benefits of PhilHealth. So alam yun ng mga local chief executive. But for LGUs that have level 2 and level 3 hospitals, ito yung mas complex procedures and higher cost of care. Sila yung gagamitin nating pilot. And then we have actually selected provinces that have actually fulfilled their commitments to universal health coverage. And these are yung mga Sarangani, Laguna, Aklan. So there are about 5 of them. Pa-prioritize ko sila. Number 2, we are also trying to prioritize LGU hospitals that are in provinces that have no DOH hospital para magkaroon ng zero balance billing yung provinces na yun. So may mga criteria kaming isusulat on how to spend the 1 billion. For the rest of the LGUs, pwede pa rin namin silang tulungan per patient basis through the MAIPIP. So ang mangyayari dito, I will ask my medical center chiefs to have a memorandum of agreement with an LGU hospital, and ipuno yung DOH hospital, papalipatin namin sila sa LGU hospital, pero sasagutin namin zero balance yung pasyente doon. So the fund continues to support our Filipinos na magpapa-basic accommodation.
Sunod, Samuel Medinilla, Business Mirror.
Good morning po. Magfa-follow up lang po kami regarding po dun sa MAIF guidelines na na-announce po kahapon. Kailan po kaya natin expected ma-complete yung guidelines?
So I expect to have the guidelines by the end of the month or by February, mid-February. So meron na kaming basic principles in a working draft. As of now, MAIP will be following the existing 2025 IRR, Implementing Rules and Regulations. So yun muna ang susundin ko until masulat namin yung current for the 2026.
I-clarify ko lang po. So sa ngayon po, until malabas yung guidelines, i-accommodate pa po muna natin yung mga existing referral letters from some politicians po.
Yes, kasi 2025 pa yun eh. That's still a 2025 fund. Hindi pa yung 2026 fund. So yung IRR will be used for the 2026 fund.
May projected na po kaya tayong transition period? Halimbawa malabas na yung IRR kung hanggang kailan po natin i-accommodate yung mga previous letters?
The moment we have the new IRR, it's immediately implementable. There is no transition.
Tapos last na lang, usually po ano yung average na number of referral letters na natatanggap ng DOH for MAIF po?
I don't have that figure. We don't count the referral letters. Basta we have the funds, we actually assist the patients.
Thank you po.
Follow-up question, Dexter Cabal sa Inquirer.
Uh, Good morning po, Sec. Mag-ask lang po sana if what brought the change of position ng DOH regarding po sa MyFIP. Kasi if we remember, parang...
Change in position?
Yes
What
po,
position?
parang sabi po
What
ng
position
DOH.
to the previous position?
Position for the sa MyFIP.
Anong position yun?
Kasi parang by July or early last year, parang gusto po sana ng DOH is parang to do away with the MAIF and
Sino nagsabi niyan?
and the guarantee letters, and ang gawin po ay
To do away with guarantee letters.
yes, and
But
directly
we really do
fund
not use
PhilHealth.
guarantee letters. The DOH does not use guarantee letters. We only give guarantee letters to private hospitals that we have a MOA with. But other than that, we don't use guarantee letters.
But ang sinabi niyo, ang sabi po ng DOH ay ang gawin po
Sinabi na Nino sa DOH. Ano yung tanong mo? Anong binago? The MAIP has been there. In 2025, we had the MAIP, Medical Assistance for Indigent and Financially Incapacitated. Meron siyang implementing rules and regulations.
ang gawin po ay parang yung PhilHealth, sa PhilHealth na lang po ibigay yung funds for the
Hindi
MAIF.
yata DOH nagsabi niyan. Hindi yata DOH nagsabi niyan. Some other health advocates are the ones pushing for... You see, what happened is, the MAIP, when it started, was called MAIP, Medical Assistance, MAP actually when it started, was because PhilHealth was so low. The support value of PhilHealth. That's the history of the MAIP. So the legislators decided to put the fund in the DOH to help support indigent patients para no balance billing. The old program was called no balance billing. The MAIP was started for no balance billing of indigents. Pas na-expand yan. But today, we're already expanding PhilHealth benefit packages. So there's been no change in position. The two support each other. We are able to do zero balance billing because we have PhilHealth, we have MyPIP, and then we have the MOOE. Yan ang reason na people feel ang zero balance billing. So wala kaming change na position.
Follow-up, Kat Domingo.
For same
ABS-CBN.
topic, sir, just to clarify, baka po kasi yung I know you're in the process of drafting the IRR, the new IRR, pero sir, ang mga normal Filipinos ba, ordinary Filipinos, papayagan pa rin po ba silang kumuha ng guarantee letters from politicians considering that the DOH has already said na hindi naman talaga kailangan yung mga GL?
Excuse me, hindi DOH po ang nagsabi yung mga mambabatas. Sila naglagay sa batas. And I will read the provision sa inyo para malinaw tayo para hindi tayo nagkakalituan. This is what Section 19 says. Prohibition on political involvement in the distribution of cash and other forms of financial assistance. All cash assistance and other forms of financial aid distributions shall be conducted exclusively by the authorized government officers and personnel or accredited partners. No public officials holding elective position, yung binoto, electoral candidates, politicians, political parties, and any of their representatives, except for officials having direct administrative and executive authority over the implementing agency, shall influence, be present in, participate in, or take part in the actual distribution of any cash assistance and other forms of financial aid in the following programs: protective services for individuals and families in difficult circumstances, tulong panghanap buhay sa ating disadvantaged and displaced workers, medical assistance to indigent and financially incapacitated patients program, and other similar government financial assistance programs. No political signage, branding, paraphernalia, or activity shall be displayed or conducted within the distribution area. The national government agencies responsible for distributing cash assistance and other forms of financial aid shall establish, formulate, adopt, and enforce mandatory requirements, protocols, and reporting mechanisms to ensure strict compliance to this policy. The Joint Congressional Oversight Committee on Public Expenditures shall monitor agencies' compliance with the requirements of this general provision. So it is in the law.
Sir,
The law now, we have to follow the law.
Secretary,
Go to the government officials that need it. So if you want medical assistance for financially incapacitated patients, you go to the medical social worker in the hospital, you go to the hospital director, you go to the regional hospital director if you're in an LGU hospital or in a private hospital.
Sir, I think what needs to be clarified kasi yung iba pong mga tao, pumipila sila sa opisina, not at the distribution site, pero dun sa opisina ng mga politiko, regardless if they are lawmakers, governors, or what have you. Hindi na po ba i-honor ng kahit anong hospital? Magkakaroon po ba ng directive clearly na hindi na mag-honor ng guarantee letters from any politicians?
Talaga to kung magtanong loaded. You know, constituents are free to ask assistance from their elected officials. But do they need a guarantee letter from them to get assistance? No. They can go straight to the Department of Health, and we will help them if they need help. And if we have the funds, we will provide the funds if they are qualified to get the funds.
Sir, if that's their option to get guarantee letters, will the DOH still honor those letters?
The law actually prohibits a guarantee letter.
Yung law
basically
distribution lang, hindi yung mismong letter. It's vague on the giving, on the handing out of GLs.
So I talked to Senate President regarding this. Of course, if you write me a letter and you want someone, the DOH, to help your constituent, we will help them. Hindi siya GL. That's a request. That's a request.
Sir, so may discretion pa rin yung mga politiko.
Hindi. What discretion? What will happen to the discretion? It's very clear in the batas. So very clear yung batas, and we will follow the law. As an executive branch of the government, we will follow what the legislators put.
Hi, Secretary Ted, Hannah of SMNI. Just idadagdag ko lang po kay Kat. Yung mga mahihirap po, example, may 1 million po silang billing sa isang government hospital. Sasabihin nila, hindi nila kaya yung 1 million. Pupunta sila sa ganitong congressman. Si congressman, si party list, bibigyan ng ganito. Guarantee letter, 100,000 lang. So may 900 pa siya. Pupunta siya kay senator. And then magbibigay si senator ng another 100. Hanggang sa mabuo nila yung 1 million nila. Sir. So, kung sinasabi ninyo, hindi na allowed ngayon sa batas natin.
No. The senator can guarantee, but sila magbayad nun. It cannot come from the GAA. Pag nag-guarantee siya maghahanap ng pera nun. No, but anyone can guarantee. I can guarantee to pay for you, but the one who writes the guarantee pays for it.
Yun lang po gusto namin linawin, sir. Kasi nakikinig yung taong bayan.
Ganito, so sa taong bayan, zero balance billing na po ang inutos ng presidente. Bayad na ang bill nyo. Kahit 2 million, 2.7 million yung malaking bill na binayaran ng DOH para sa pasyente. Zero balance. Magpa-admit kayo sa basic accommodation at zero balance po. Hindi kayo withhold ng treatment. Treatment will be given to you.
Secretary,
So, zero balance billing na tayo since July of 2025. So number 1 yon. Kung ikaw ay nagpunta sa private hospital, talagang may babayaran ka. Kasi nag-private ka eh. You have to pay for the doctor, the room, the medicines because you went to a private hospital. But for the DOH hospital, zero balance. Now, if you go to LGU, pwede namin tulungan ngayon through the medical assistance for indigent patients. So kailangan makipag-coordinate with the hospital director of the DOH or the regional director of the DOH.
one final question, Secretary. So, you're saying po is, hindi na kailangan ng mga Pilipino
Get
pumunta sa
assistance.
mga congressmen and senators dahil kaya na ng DOH i-zero balance yung kanilang balance po sa hospital.
Sa Department of Health Hospitals, kayang i-zero balance sila.
Okay po. Malinaw po.
So po nakatanungan, Eden Santos, Net 25.
Secretary, follow-up lang din po ako dun sa pinag-uusapan. GL po kasi, minsan nga ho, 10,000 lang, Secretary, binibigay po.
Let me just be clear, nagkaka-confusion tayo dito kasi you're all fixated on this guarantee letter. The DOH does not operate on guarantee letters. That is not our guarantee letter. So do not ask me about those guarantee letters. Ask the people that issue them. Kasi hindi naman po kami nag-i-issue ng guarantee letter.
Pero po yung mga ospital, pwede nilang tanggapin yung mga guarantee letters from the congressmen, senators. Pwede pa rin po yun. Yeah.
Sa private
Through
hospital,
GL.
this is private hospital?
Either private or government hospital po. Gumagamit sila ng GL.
That's their decision. Wala ako yatang role. If they want to accept a guarantee letter from a politician, that's up to them.
Ayun, yun po, malinaw po. At least,
But the
tuloy-tuloy pa rin naman
disbursement of
pala
the
po yung
funds-
GL, paggamit ng GL, ano po. Anyway, ano ko po doon sa basic accommodation, Secretary, ito po yung mga government hospital, tama po ba?
DOH hospital,
Ayan,
so for
DOH
zero
hospital.
balance billing,
Yes.
basic or ward accommodation. Ito yung shared accommodation.
Apo. Sa zero balance billing po
Yes.
ito. Ano pong iba pang programa ng DOH na maaari pong makatulong naman doon sa mga kababayan natin na yung kanila pong sakit ay hindi naman po pwedeng i-treat under the basic accommodation. So kailangan din po talaga nila doon sa private hospital dahil yung sakit po nila ay hindi po matitreat doon sa mga ospital.
May I know what condition that is?
Like cancer,
We treat cancer in government hospitals.
gaya po ng PGH.
Gaya ng DOH hospitals.
PGH is DOH hospital.
No, it's not a
No?
DOH hospital. It's a University of the Philippines hospital.
So hindi na po siya yung parang government hospital like before.
It's a government hospital, but it's a university-based hospital. It's not under the Department of Health. It was never under the Department of Health.
Okay. Ano-ano po yung mga ospital na
Madami
pwedeng
tayong misconception, ano?
ng
Madami
ating
tayong
mga kababayan
misconception.
kasi po akala nila ang PGH ay under din ng DOH. and
Hindi
sa
po
government
under,
hospital.
so that's the job of the media to tell people that the Philippine General Hospital is called UPPGH, University of the Philippines, Philippine General Hospital. It is under the budget of the Commission on Higher Education. Hindi siya budget ng Department of Health.
So ano-ano po yung mga ospital na ito para po yung mga kababayan natin, alam na nila kung saan po sila pupunta para sa zero balance billing.
Ang matagal na po nating inanunsyo, nasa website po ng Department of Health ang listahan ng DOH hospitals sa lahat ng region ng Pilipinas.
Dito po sa Metro Manila na lang po.
We
para
have
yung-
22 in Metro Manila. Do you want me to enumerate them?
Pwede naman po para mas...
I'll just send you the list of
Okay,
the
sige
22.
po.
Okay.
Sa PhilHealth po, yun pong 60 billion pesos na isosoli po sa inyo sa ilalim po ng 2026 General Appropriations Act ay naisoli na po ba or kailan po ito maisosoli?
So, bago pa po na isama doon sa ating budget yung 60 billion, naglabas na po ng direktiba ang ating Pangulo na ibalik noong September. So, yun naman po ay pinakinggan ng ating mga mambabatas at sinama na nga po doon sa ating GAB before po na enact as GAA. So, na-aprubahan lang po nung nakaraang pong Lunes, kaya maghihintay po ngayon kami sa sangguni sa Department of Budget kung kailan po marirelease. Pero nakasaad na po doon, nakasama po yung 60 billion na yan.
Pero po nung kuhanin iyon ng government at ilipat sa National Treasury, cash po ba yon na kinuha sa PhilHealth at dinala sa National Treasury? Yung pong 89 billion and then yung 60 na tira na lang po yon.
Although nangyari po yung transaction before po ako nahirang na maging presidente po. Pero ang alam ko po, electronic transfer lang po. But cash basis po yon. Kasi pagka na-transfer po at automatic po, debited or credited na po yun doon sa accounts ng Treasury.
Let me clarify. Mali yung sinabi mo. 89.9 yung pinarevert to the National Treasury. 30 million tranches were given. 30 billion
And then second.
ang first tranche, and the second tranche was also 30. So 60 yung naibigay sa National Treasury. At ito ginastos din sa health. These were spent for health emergency allowance, about 74 billion. It was spent for Health Facilities Enhancement Program. It was spent for MAIPIP, Medical Assistance for Indigent Program. So this was the cash used to fund those programs that were already in the GAA. So health to health din to. There were just a few billion na ginamit for infrastructure. Thus, the remaining 30 billion, yung 29.9, hindi na na-release yun because of a TRO by the Supreme Court. So 60 billion lang ang na-revert but ginamit din sa health. Ngayon pinabalik yon. So actually, nag-benefit ang health. Kasi ginamit natin yung 60 to other portions in health, tapos binalik pa uli sa PhilHealth yung 60 niya. So parang nangyari, nahiram lang siya. To help health, to also put health. So parang nagka 120 billion additional sa health.
Ayun po. Kasama na po yung 60 under 2026 national budget.
Yung sinabi ni President, ibalik yung 60 through the budget yon. That's the only way to bring it back.
Kaya parang lumabas ng 120 billion.
Nadagdag sa health.
Okay. Sa PhilHealth pa rin po, paano po, saan-saan po pwedeng gagamitin itong maibabalik na 60 billion from PhilHealth, dinala sa National Treasury, and then balik ulit po ngayon sa PhilHealth?
So, gaya po nung nasabi ko kanina, may maturity phases po yung mga programang nilalatag ng PhilHealth. Hindi ho ito parang on and off button lang na pag inon mo automatically buong Pilipinas nagpo-provide ng ganitong serbisyo. So may ramp up po 'yan at ang una pong malaki po ang tingin naming pagpupuntahan nito po ay yung ating primary care program. So ngayong pong first quarter palalaganapin na po namin yung gamot access nationwide dahil medyo na ayos na po namin yung sistema. Yung iba naman po, yung nilabas na mga Z packages nung nakaraang taon, 2024-2025, ay nagmamature pa. At yun nga po yung sinabi ko, kailangan po namin ng cooperation ng provider na mag-align at mag-affiliate, ma-accredit as provider. At dahil po nakita na po nila na mabilis po yung bayad at nakikinabang nga po yung even the professional fees of the doctors are substantially covered. Marami na pong nadagdag na mga facilities na nag-o-offer po nitong ating Z package acute myocardial infarct. Kahit po private hospital ngayon no balance bill na. Kasi nakikita po nila yung iba pong pasyente lumilipat na ng ibang hospital. So yun po yung market pressure na pati yung private hospital nag-i-engage na. Yung iba naman po ay mga dagdag pong benepisyo. Siguro po ang bibigay na po natin yung pagkakataon na ang ating Pangulo po. Marami pa pong lalabas ng mga bagong benepisyo ngayon pong first quarter. Hayaan na po natin ang ating Pangulo mag-announce.
Sunod po na tanong.
Last na lang. Paano po yung monitoring natin para ma-assure po na yung mga nagbe-benefit ay talagang karapat-dapat po?
Gandang tanong po yan. Kasi nga po, ang isang pinaiigting namin ay yung fraud detection at saka yung quality of care. So kagaya po sa yakap, may requirement na po tayo na meron pong PhilHealth Check Utility, parang biometrics checking before ho namin bayaran ang pasyente, ang provider, sorry. At yun po, ina-attach po yung validation na check natin yung veracity ng liveness ng patient dun po sa kanilang medical records na fina-file sa amin. Meron din pong parang yakap empanelment slip na kasulatan kung ano po yung benepisyong dapat nakukuha ng pasyente na parang patient bill of rights na bago po bayaran again yung ating mga providers ay napakalinaw po na tinatanggap at naiintindihan both by the provider and the patient kung ano po yung katungkulan ng bawat isa. So, bukod po doon, yung boots on ground na na-mention ko kanina na talaga po gagala at talaga po mag-spot checking nitong ating mga providers.
Sunod po na tanong, Michelle Gilang, All TV.
Good afternoon po, Sected. My question is a different topic. We are aware of a surge of super flu cases in the United Kingdom and in the U.S. Given this risk of super flu, what is the Department of Health doing to protect Filipinos from this?
Okay, so flu is a seasonal infectious disease. Actually, we've detected the super flu here. Since we reviewed our Epidemiology Bureau's surveillance of flu cases, and we've actually detected about July-August about 17 cases that were determined to be of the new subclass of the super flu. All of them have recovered. So as you very well know, flu is a self-limiting illness unless meron kang medical condition, may cancer ka, may elderly ka. So we still recommend the use of the flu vaccine. Although yung super flu, yun yung sinasabi nila, it is able to avoid the flu vaccine. So kaya nga mas maraming serious conditions in North America and the UK where there is winter. So matindi, malamig na malamig kasi doon ngayon. So mas matindi yung flu cases nila. Our flu season actually is during the rainy season sa Philippines. So iba tayo. We have in our vaccine actually carries that influenza A, the Southern Hemisphere vaccine. It contains that vaccine. So as long as makapagpa-vaccinate yung high risk, if you're a young individual, you get flu, the same precautions, public health precautions. If you're sick, stay at home. If you're infected, you have upper respiratory infection, you should cover your face with a face mask. And then better stay at home and then recover para you don't spread the flu.
Secretary, just a follow-up. When you detected the 17 cases of superflu in July and August, what interventions did the Department of Health do?
We only detected that after the review. When that was announced by the US, we found out that in our surveillance of diseases, lumalabas na pala yun. This is Metro Manila, no? Metro Manila. But all have recovered. So it's part of, you see, ang flu, madaming variants yan. So we try to detect, there are about 80 plus variants, I think. And what they do with the vaccine is the WHO has this methodology to predict which ones are the most probable. In fact, the vaccine you get for going to North America is different from the vaccine we give here in the Southern Hemisphere, based on predictive models yan. So hindi binibigay lahat ng variants. Only what they predict will be the epidemic for that year. So ganun ang production ng flu. So ang advice namin sa flu talaga is still public health precautions, cover your mouth and nose pag uubo ka. If you're immunocompromised, get the flu vaccine. Yun.
Sunod po na tanong, Chloe Fana, Business World.
To Mr. Mercado, sir, nabanggit niyo po kanina yung fraud control measures. So, a recent PIDS study called for an overhaul of PhilHealth's fraud control measures, calling for a shift to a proactive approach and an expansion of definitions amid a transition to a global budget setup. Is PhilHealth planning on implementing this, and what kind of changes will PhilHealth make to its fraud control measures?
So, meron nga pong pag-aaral na nilabas ang Philippine Institute for Developmental Study. Pero ito nga po, gaya ng nabanggit ni SecTed, medyo dated nung previous years. So, ngayong taong ito po, marami po kaming nilagay na mga gates. Kumbaga po, may mga pre-authorization, merong pre-validation para maiwasan. Kasi mas maganda po na preemptive yung pagsasala natin kung ano po yung mga i-cover natin. Kaysa na-deliver na yung care, tapos lalo na kung nabayaran na namin, tsaka namin hahabulin. So yun po, sinistrengthen namin. So meron na po tayong isasagawa within this quarter na parang AI-enabled na pre-validation ng mga claims. Kapag pinasok po yung e-claims, madidetect na po kung nagmamatch yung diagnosis dun sa mga lab test na ginawa. So basically po, doon pa lang pa-flag na po namin kung ano po yung potentialing hindi karapat-dapat. Pero ang mas importante po, preemptively, yung nga pong mga pasyente natin na mapaliwanagan kung ano po yung mga serbisyo at saka yung mga benepisyong kailangan nakukuha nila. Maglalagay po kami ng mga posters po ngayon sa hospitals na ito po yung karapatan nyo pag no balance bill or basic accommodation kayo at ano kayo ng Z package, dapat wala kayong bayaran dito sa mga accredited na hospitals. So, kasi yung asymmetry of information na yon yung minsan nagkakaroon din po ng problema. So yun po, pinapalakas namin yung aming communication program. Maglalagay po kami ng mga gates para po ayusin at saka po yung AI, gamit ng AI. At i-inform po namin yung mga pasyente kung ano po yung kanilang mga benepisyong dapat na tatamasa.
And sir, with the increased budget this year, how much could premium income increase as well?
Premium, hindi dapat.
So yung pong budget, yung premium income po ay usually galing dun sa mga direct members. Yun po yung mga employed and gainfully kaya magbayad. So hindi po yung sakop nung budget. Ang budget po ay dun sa ating indirect members o yung pong mga kababayan natin na walang kakayanan magbayad ng kanilang premium. So yun po ay base sa tala ng DSWD na kami po ay closely also coordinating. So in terms of the premium payment po, ang doon sa mga formal sector, ang pinofocus po namin ngayon efficiency. So talaga pong nakikipag-usap kami doon sa mga employers. Babaguhin din po namin this quarter na kami na po ang nagge-generate ng statement of account, for example, para pong billing statement ng credit card. Dati po lang nagge-generate yung employer Kaya hindi ho namin na-check. At least ngayon po, may na-check but randomly. Ngayon po kami magge-generate para mas malinaw po. So yun po.
Sunod po ng tanong, Ace Romero, Philippine Star.
Secretary, may we get your reaction to reports that President Marcos is seeking your replacement allegedly because of the various issues that the DOH is facing?
There's no truth to that. I think Yusek Claire already said yesterday that there is no revamp of the cabinet. But we in the cabinet all serve at the pleasure of the president. So if ever the president wants to replace me, that is the prerogative of our president. We continue to fulfill all his mandates, zero balance billing, bukas centers, and all this focus on the higher budget is emphasis on health. So I think we will continue to pursue the mandates of the president with emphasis on better healthcare for all Filipinos.
Thank you, Secretary.
Last two question po. Eugene Fernandez, IBC 13.
Sir, gusto ko lang bumalik dun sa zero balance billing. Itanong ko lang, since you mentioned earlier that there's an additional 1 billion for the LGU for the zero balance billing and also another 1 billion para sa mga specialty hospitals. How much ba yung total ng budget ng DOH na i-assign for the zero balance billing?
I don't have the exact computation, but zero balance billing is fulfilled through the budget of the hospitals. So our MOOE, which is about 200 billion, our PS, which is about 100 billion, plus the MAIPIP, which is about 51 billion, 50 plus billion. So all of this will be used for, plus PhilHealth, because PhilHealth also pays for benefit. As of now, ang nakikita namin about 30% of the cost of hospitalization in the DOH hospital is paid for by PhilHealth. So malaking bagay sa amin yung reimbursement nila of services rendered to the patients. So pag binabalik nila yun, naro-roll yun namin yun. So there's a revolving fund. Also, there's another source of fund we call the retained budgets. So in the special provisions, the DOH hospitals, unlike LGU hospitals, DOH hospitals are able to retain income. So if there is extra budget, we do not return it to Treasury. We actually retain it and roll it to buy more medicines, give it as supply. So binabalik namin yan as services. So these are the sources of funds. So in other words, we are able to provide zero balance through multiple sources of funds. Very important yan. LGU, so we can now continue to support that now that we're able to do it in DOH hospitals. And we had a 20% increase in patients going to DOH basic accommodation. So now we feel to fulfill universal health coverage, kailangan talaga mag-zero balance din sa LGU-run hospitals. So the 1 billion in the fund for MyPIP, which is actually a pilot project on how much we will cost. As we understand how much will be needed to be utilized in LGU hospitals, we can request for the proper. In the future, what we can see is that the MAIPIP will decrease as we are able to increase zero balance billing in both DOH and LGU hospital. Kasi isipin nyo, hindi mo na kailangan ng MAIP kung zero balance ka sa both LGU and DOH hospital. Just go to the government hospital. And if you have money, you go to the private hospital.
So, gusto ko lang din pa i-clarify naman yung sa MAIP. Kasi since you mentioned earlier na parang you encourage people to go directly to DOH para humingi ng, request letters, guarantee letters, or, hindi nyo naman po sinabi na guarantee letters, na para sa mabawasan or mapababa yung kanilang gastusin. Gusto ko lang itanong, sir, so bawal sa private hospitals, na mga na-admit sa private hospitals, dumiretso sa inyo to ask for assistance?
So in the IRR that we're drafting for the support fund to LGU hospitals, sa MAIP, we are going to use basic accommodation and semi-private. Pero kung naka-suite room ka at single room, palagi ko hindi ka qualified to use medical assistance fund from your tax money. Tax money niyan. I will use it for people who are siguro nagpa-admit sa basic accommodation in the private hospitals. So 10% of private hospitals are supposed to have basic accommodation. So we can support that. PhilHealth will pay for part of the case rate, and then we can also support that. So yun yung isang methodology namin on the excess capacity. Pagka napupuno na ang DOH hospital, I told my hospital directors to have an agreement with the nearby private hospital who are willing to take in our patients for admission para ma-admit, and then we will support it with zero balance support fund.
And last question na po. Itanong ko lang, since we are drafting the new IRR for the MAIF, aren't we considering to, since we are asking about yung bawal yung EPAL, yung mga politicians, pagdating sa pagbibigay ng medical assistance, on banning yung mga request nga from politicians na ibibigay sa DOH para mabigyan sila ng medical assistance through MAIF, ayaw nyo ba na parang i-ban mga bagay?
We follow the law. The law says bawal yung mga signages and everything. We will follow what is written in the law. So the IRR cannot be more than the law. It's only what the law says, and then we will just elucidate yung details of how it will be implemented.
Kasi sir, parang I asked that question kasi nga kanina, we are still standing. Kasi yung mga tao madalas sila pumila.
Can I interrupt you? Ang premise nyo kasi may GL pa rin. Wala nang GL because may zero balance na eh. The reason we put up the zero balance billing is so that wala na, hindi ka na dadaan sa politiko. And I've met some of the patients, I've gone my rounds in DOH hospitals. Hindi sila dumadaan sa politiko, dumidiretso sila, pumila sila sa outpatient department ng hospital namin at nagpa-admit. May trabaho, narinig nila yung zero balance at wala silang binayaran nung naoperahan sila at nakauwi sila. So, as long as we inform people na zero balance billing na po sa basic accommodation sa DOH hospital, there is no need to go to an elected official.
Last the question, Ivan Mayrina, GMA 7.
Secretary, you mentioned you were happy about Section 19. Dahil bago ho ito, pre-Section 19, what was your experience as Secretary? And then how do you intend moving forward to insulate the DOH and follow this Section 19? Since it only says that politicians are not allowed to be involved in the distribution, but that doesn't prevent them from writing you request letters or whatever letter, hindi lang tawag siguro guarantee letter.
My thinking is that with the zero balance billing policy, there is less need to go to an elected official for healthcare. That's the concept of the executive department saying na we will provide the assistance. You give the money and we will provide the healthcare. So gusto mong magpa-opera sa heart center, we will help you get admitted in a heart center and be operated on kung kailangan ng operation. So there is no need to go to an elected official if you have a medical problem. If you have a medical problem, you go to a government hospital and the government personnel there will take care of you.
So, again, kung halimbawa ho, tumawag si Kong, tumawag si Senador, tumawag ko si kung sino, si Gob, si Mayor, are you going to take a different stance and just tell them na may zero balance billing na tayo, you know?
No, what we will do is to help their patient. If they have a patient that requires patient navigation. So you're now going towards what is called patient navigation. And I need the media's help because the healthcare is very complex. Pag kayo nagkasakit, di nyo alam kung saan pupunta eh. Di ba? Kung may condition ka, masakit ang buto mo, balakang mo, may kidney, you don't know where to go. So some of these people, ang kilala nila is the elected official. So they go to the elected official. So I'm trying to change that with my Public Health Promotion Bureau to try to inform people. May show nga ako eh. Every Saturday, I talk to the people to explain about diseases. If people know how to get healthcare, they wouldn't go to an elected official. They would go straight to the doctor. They would go straight to a Buka Center, straight to a DOH hospital, straight to the heart center. So, ang key is I think our problem is health literacy. Many of the Filipino people do not know what to do when they get help. So the primary care program of PhilHealth is a very important method kasi ang magna-navigate sa'yo is your primary care physician. The primary care, that's universal health coverage. Wala ka nang iisipin, hindi ka na kailangan pumunta sa politiko or some other person for assistance.
Sek, panghuli na lang po. Mawawala na ho ba mga malasakit centers?
Batas din yan eh. Batas din yan that was also created by law that consolidated. Mari-repurpose siguro siya. I think what's going to happen is it will be our area where we can do patient navigation. Ang nasa Malasakit Center by law are PhilHealth, nandoon ang PhilHealth, so malalaman mo kung magkano makukuha mo sa PhilHealth. Number 2, DOH, so malalaman mo kung anong makukuha mo MAIP, so you can still go to a Malasakit Center to get the MAIPIP. And number 3, DSWD. Yung DSWD, nagbibigay yun ng AIX. Yung AIX, binibigay yun kasi hindi namin masagot yung pamasahe noong pamilya pauwi dun sa barangay nila. Kung kailangan nilang pamasahe, libre nga sila, zero balance, but the DOH cannot pay for your taxi or your ride home. So ang tumutulong doon, DSWD. And then meron pang isa, PCSO, I think, is the other agency that sits there. That's under the Office of the President. Nagbibigay ng mga outpatient medicines pa naman siguro yun. But hopefully yung gamot program could help support even the outpatient medicines.
Para po sa huling katanungan, Maricel Halili, TV5.
Hi sir, Secretary, yung sa akin para for the record lang po. About the super flu, the DOH does not find it concerning, or at least how alarming is this?
Not alarming, but there is a new variant out there. So I think the warning I will give is for Filipinos that will travel to the temperate countries, that will go to North America, to the UK. If you're going there, be knowledgeable that there is a spread of super flu in that area. Maybe get the Northern Hemisphere vaccine. That's my best advice for them. Kung magta-travel kayo, bibisita kayo sa kamag-anak nyo sa malamig winter places, get the shot. The Northern Hemisphere shot, not the Southern Hemisphere shot.
Sir, last, I do not know if this is covered, if this is under DOH, but there are reports na meron daw mga people deprived of liberty na nagkakahawaan ng tuberculosis inside the Lingayen Provincial Jail. I don't know if this is under DOH or LGU. Ang intervention ba and assistance should come from DOH? Paano po yung pwedeng?
We can assist, no? Lingayen, that's in Pangasinan. So we will assist. We've done that in Metro Manila, sa Manila City Jail. Nagkaroon tayo ng outbreak of tuberculosis, and we started diagnosing and treating them. So we have the methodology. So what we can do is mag-coordinate lang siguro yung BJMP with our regional office. We have a hospital in Dagupan, yung Region 1 Medical Center. We can help that Lingayen. Immediately after this, I will call my kaka-retire lang pala ng regional director ko sa Region 1, the OIC for Region 1 to help Lingayen Jail. Outbreak. Yeah, so this is our problem with the PDLs. They are in confined spaces, and as you very well know, maglagay ka ng isang TB patient dyan, magkakahawahan talaga because of the congestion. So we need to diagnose them and separate the TB patients.
Maraming salamat po. That's the last question, Yusek.
Thank you very much. Secretary Ted Herbosa and PhilHealth President and CEO Dr. Edwin Mercado. Papasalamatan din po natin. Nandito po si Dr. Ana Renolayan, ASEC, of course, Dr. Albert Domingo, and Director Tina Marasigan. Thank you very much po.
Thank you very much, Yusek.
Maraming salamat po.
Okay. Thank you. Salamat sa inyo. Zero balance na. Huwag nyo nang problemahin yung GL.
At bago tayo magtapos,
Masyadong sikat yung GL.
PNP at DILG tiniyak na puspusan ang preparasyon para sa pista ng Poong Nazareno. Alinsunod sa direktiba ni Pangulong Ferdinand R. Marcos Jr. na panatilihing payapa at makabuluhan ang idaraos na traslasyon, naka-alerto ang puwersa ng PNP, DILG at ibang ahensya ng gobyerno upang siguruhin ang kaligtasan ng mga dadalo sa nasabing kaganapan. Ayon sa tala ng pulisya, aabot sa 18,212 uniformed personnel ang idideploy sa mga lokasyon na pagdarausan ng pista ng Poong Nazareno. Makakaasa sa increased police presence and visibility ang mga debotong lalahok sa traslasyon, lalo na sa 3 major areas. Sa Quirino Grandstand, sa buong ruta ng daraanan ng prosesyon, at sa Quiapo Church na huling destinasyon ng imahe ng Poong Nazareno. Ipinag-utos ni PNP Chief Police Lieutenant General Jose Melencio Nartates Jr. sa mga tropa ng kapulisan na maging alerto, mahinahon at makatao sa pagsiserbisyo sa kapwa Pilipino. Para din sa dagdag seguridad, magpapatupad ng no-fly zones ang PNP malapit sa pagdarausan ng traslasyon habang may cellphone signal jammers din bilang additional preventive measure. Nagpaalala naman ng DILG sa mga lalahok na maging alerto at iwasang magdala ng mga matatalim at nakakasugat na bagay, mga paputok at pyrotechnic devices, mga lalagyang babasagin at iba pang ipinagbabawal na kagamitan. Mahigpit ding ipinagbabawal ang pagdadala ng armas gaya ng baril alinsunod sa ipinapatupad na gun ban sa lungsod ng Maynila. Naway maging matiwasay, ligtas at makabuluhan ang selebrasyon ng Pista ng Poong Nazareno para sa lahat ng deboto.
Noong nakaraang taon, umabot sa 8 milyong deboto ang limahok na mas mataas kumpara sa 6 na milyon noong 2024. Abot sa 18,000 pulis at force multipliers ang nakadeploy sa translasyon sa darating na Enero 9. Unang inanunsyo ng National Capital Region Police Office ang signal jamming sa bisinidad. Simula naman sa January 8 ay may mga kalsada nang isasara.
Kundi bahagi ng pagbabagong buhay mula sa personal na pagsubok tungo sa aktibong paglilingkod sa kapwa.
At dito na po natatapos ang ating press briefing. Magandang araw para sa bagong Pilipinas.